Oxygen is really essential to life. There's a difference between hard chambers and mild hyperbaric chambers, the soft chambers. Here we use a mild hyperbaric chamber, which we can get it to 1.3 ATAs. The studies are showing now, they're doing more and more studies showing that between 1.2 and 1.3 is the ideal pressures to be using on people with traumatic brain injuries and autism and cerebral palsy. There's a lot of studies that are just coming out daily about the effects of hyperbaric chamber. With a hyperbaric oxygen therapy, we take a person, we can put them into the chamber and we put them under pressure. And we pressurize the chamber to the point where we go up to 4.2 psi in a mild hyperbaric chamber while the person actually has an oxygen mask on. As the person gets pressurized and as the body has more and more oxygen delivered to it through the mask, we are taking this oxygen and we are squishing it and getting it into the plasma and increase it tenfold to different areas of the body that need it. Oxygen is great at healing. In fact, it's so much more important than even blood. It's most important to get the oxygen to the different parts of the body that needs it most. So there's a lot of debate whether it's better to have a mild hyperbaric chamber or a hard hyperbaric chamber. And here's the thing, it's just like laser therapy. We have class 2 lasers, class 3 lasers, class 4 lasers. And we have them all here at this clinic. They're all used and utilized for different purposes. The mild hyperbaric chamber is utilized better for certain conditions like mild traumatic brain injuries, cerebral palsy, and things like autism. And then you have the hard chambers. And the hard chambers are used more for acute issues, something that's really severe burns or people with diabetic wounds. One's not necessarily better than the other, they're just utilized for different purposes. We unzip it for you. You get in our chambers, we actually have a multitude of pillows everywhere, so you're really comfortable. We have you put on an oxygen mask. We have a couple clips. One of them is for a fan, so we can make you nice and cool and cozy. We have a nice blanket in there as well, and then we have another clip that you can clip your iPhone to, where you can actually watch some YouTube videos or whatever have you, or listen to some music. And then you just basically let the chamber fill up. So a lot of people take naps, which is different from the hard chambers. The hard chambers, you have to be in a cotton suit and you can't take in devices like phones. And whereas a lot of people love our cozy pillows, we do have patients that have claustrophobia. It's roomy enough that you can actually take your whole arm and just reach up to the top of the machine. So we can remove a lot of these pillows and make it a little bit roomier and cozier for you so you're not having any attacks while you're in the chamber. It's really pleasant. So we have a lot of people schnoozing away in there.